Welcome back, friends, to TV5 News at 9. Joining us this morning, real treat, Dr. Omar Gayar. Thank you so much for being here. How are you today?
Great. Thank you for having me again.
Of course. We're delighted that you're here. We are talking all about prostate cancer and proton therapy, friends. So, Dr. Gayar, what is prostate cancer?
So I guess I should start with what is the prostate. The prostate is an organ or a gland that's specifically located only in gentlemen in the pelvis. That actually sits below the prostate in the urethra, where the urine comes from, actually runs through it, and it's right in front of the rectum. And prostate cancer can develop in this organ, and it's actually one of the most common cancers that can develop in gentlemen. And so that's something that we have to watch for in a lot of gentlemen for screening.
Yeah. Now, Dr. Gayar, who is at the greatest risk for prostate cancer?
So as I mentioned, it's a very common type of cancer in gentlemen, and so in particular, gentlemen over the age of 50 are at risk for this. Yes. So that age is one of the bigger risk factors for prostate cancer. So I'd encourage anybody 50 or older, to at least discuss with their primary care physicians or the urologist to see if screening is right for them at that time. And usually, lab draws with PSAs and rectal examinations are critical for this. In particular, anybody who might be having any urinary symptoms or difficulty urinating that's developing, or anybody who has any prostate cancer history in their family may be at a little bit of a higher risk. So it's a good idea to talk to your physician at that point to make sure to screen for prostate cancer.
Now, doctor, why might proton therapy be a good treatment option?
Yeah, so radiation therapy in general is actually very routinely utilized quite often in the treatment of prostate cancer. So there's quite a few treatment options like surgery and radiation and hormones that can be considered. And radiation is very, very frequently utilized in general, either in and of itself, just for a curative intent for the treatment of prostate cancer, even sometimes after surgery, with fantastic outcomes oftentimes. But proton beam therapy is a targeted means of radiation therapy in which we can even better target the prostate and any surrounding structures and lymph nodes, for instance, or any other glands like the seminal vesicles that we may want to treat. In the meantime, in it being targeted, we can help target what we want to treat and reduce the dose that goes to surrounding structures and organs like the rectum and the bladder. And this actually can help maintain just as great outcomes and make the treatment course a lot more tolerable for patients, so they get to have their cake and eat it too. A lot less side effects and lower risk of complications down the line as well.
Sounds like a great option. So how can patients find out if proton therapy is right for them?
Yeah, if anybody is diagnosed with prostate cancer and they want to see if radiation and proton therapy is right for them for their prostate cancer, they can reach out to us at McLaren Carmanos, and can reach out to 855-MY-PROTON, call 855-MY-PROTON, or visit us at mclaren.org/proton treatment. Either I or one of my partners would be happy to meet with you and review your case and see if radiation and proton beam therapy is right for you.
A lot of great information you gave us today. Thank you again. Appreciate you calling in, doctor.
Thank you so much. Thank you for having me again.
Of course, you're so welcome. You can find out more information in the hot link section at WNEM.com.